6-minute walk test. 6-minute walk test is developed by American Thoracic Society in 2002. It was specifically for a patient with a lung dysfunction. It's a submaximal exercise test used to assess aerobic capacity and endurance. It helps in a comparing individual lung function as well as other parameters have been improved or deteriorated. Advantage of this test is useful in all age group of from children to geriatric patient. It requires minimum equipments, evaluate function of all system, pulmonary system, cardiac system, neuromuscular metabolic system, peripheral circulatory system. How should one prepare for the test? It is important to wear comfortable clothes, appropriate temperature. You should wear comfortable shoes and have a light meal. And remember, you should not perform any sort of exercise and warm up before the test. The test method is very simple. Mark out a 13-meter walkway without any obstacles. You may keep on at start and end point. Begin the stopwatch and start the test walk as fast as you can from one end to other and back to complete one round. Make sure you go around the end point and do not make a sharp turn. Complete as many rounds as you can in a 6 minute. It is normal to get out of a breath and some participants need break between. It is allowed to lean against the wall and catch a breath while the test is on. Remember not to stop time for any such a break. Congratulations, you now calculate your own personal best. Number of a completed round in a 6 minute. The next time you perform the test, if you walk greater, then improve functionality. And if you walk lesser distance, decrease function. Do not compare result with others. There are many different factors that are different from each individuals. For example, gender, age, BMI and height. 6-minute walk test is an easy test, better tolerated, more reflective of activity of a daily living than the other walk test. 6-minute walk test require 100 feet whole ways. Indication of a 6-minute walk test: pre-treatment and post-treatment comparison, lung transplantation, lung resection, lung volume reduction surgery, pulmonary rehabilitation, COPD, pulmonary hypertension, heart failure. Functional status: COPD, cystic fibrosis, heart failure, peripheral vascular disease, fibromyalgia, older patient. Predictor of morbidity and the mortality: heart failure, COPD, primary pulmonary hypertension. Contraindication of a 6-minute walk test. There are two type of contraindication: absolute contraindication and relative contraindication. Absolute contraindication: unstable angina during the previous month and myocardial infarction. Relative contraindication: resting heart rate of a more than 120, systolic blood pressure of a more than 180 mm of Hg, and diastolic blood pressure of a more than 100 mm of Hg. Safety issue of a 6-minute walk test. Location where rapid response to an emergency is possible. Supplies available include oxygen, sublingual nitroglycerin, aspirin, and albuterol. Technician should be certified in cardiopulmonary resuscitation. The patient is on a chronic oxygen therapy. Oxygen should be given at the standard rate. Reason for immediately stopping test: chest pain, intolerable dyspnea, leg cramps, staggering, diaphoresis, pale or Asian appearance. Required equipments: stopwatch, mechanical lap count, small cones, worksheet, source of oxygen, sphygmomanometer, telephone, automated electronic defibrillation. Conclusion of a 6-minute walk test. The 6-minute walk test is a useful measure for functional capacity targeted at people at least moderately severe impairment. The test has been widely used for a preoperative and the postoperative evaluation and for measuring the response to therapeutic intervention for a pulmonary and the cardiac disease.